the last time that I saw you, we did some filler. We did your cheeks and we did your jawline. How was it with the jawline healing?
Jaw was great. Actually, that was not painful even during the treatment.
Okay.
But like no bruising, no swelling.
Good.
And I saw the results right away, so it was great.
Good. And then cheeks? How did
Same.
this-
Same.
okay.
A little sensitive, but no swelling, no redness, and so it felt like it healed really quickly.
Okay. And then how do you feel today about filler versus Botox? What are your thoughts? Let me grab a mirror for you and you can take a peek.
So what I'm seeing is more like movement in the forehead.
Okay.
I don't think really like cheeks. I'm really happy with the volume, so I wouldn't do anything there. But I'm thinking
agree.
like maybe down here it feels a little bit changed or hollow from last time. But mostly I'm thinking like the Botox or just a little bit of a forehead adjustment.
Okay. I do see a little bit of volume loss here. And everybody, this is a normal breakdown spot. There's a little bit of depression here. This is called your piriform aperture. And as we age, the bone does shift and demineralize so we can get hollows. And then there's a pretty strong muscle that helps our lip move up and down. And that muscle helps to break down the fat as well. So a little bit of a double-edged sword there. I think you could do a little bit, just a bolus right there, and that would help just to elevate that instead of directly filling this. I think that's when people start to look a little awkward because you should have a natural transition there.
Yeah.
I'm noticing just a little tiny bit of hollowing in the temporal area.
Yeah.
And that is something we can put just a small, soft whiff of filler into, and it just softens the transition. And again, that's just a bone aging issue, but we can help to restore it with a little bit of superficial soft filler.
Yeah.
But the temples and treating in this oral commissure area tends to be high risk for bruising.
Okay.
So even though I do not think that you'll be very swollen, if you bruise, it's a pretty significant bruise and it may be harder to hide tonight for the event. So my best recommendation is certainly let's tighten up the Botox. That little baby bruise, if you do get one, is not a big deal. But with the filler, I think perhaps we should hold off on that. What's your thoughts?
Yeah, I agree.
Because I want you to go with your best confidence.
Exactly.
That's the most important thing.
I agree. If knowing that my skin's usually sensitive or reactive, then I totally agree.
Yep. And then the last time you were here, we also talked about skin resurfacing and helping to get rid of some of the sun damage.
Yeah.
And I think that would be a nice ideal for you too, especially where we have you all revolumized and we're going to smooth you out with the Botox. But I know that you're going on vacation, so we should consider doing the resurfacing towards the fall.
Okay.
And you have a history of melasma, correct?
Yes.
So we really need to choose lasers that are going to be protective of that and not get that excited. However, if we do aggravate it with any of the laser treatments, we can bring it down, we can calm it down, so it's not the end of the world, it's manageable.
Yeah.
But I think the skin quality and getting rid of some of the sun damage, I think the risk is worth the benefit.
Yeah, totally agree.
Okay, so what are your thoughts for coming in today? What would you like to address?
I would like to address my forehead, I think, and then my marionette lines.
Okay, perfect. So are you thinking Botox filler? Do you have one or the other that you're preferring?
No preference.
Okay, perfect. When was the last time you had Botox?
Probably like a week before I came here
Okay.
last time, but
Okay.
it really didn't take.
Okay.
Because, I'm seeing droop.
Okay, so the last time you saw me was in April, and then you had
So
it like
was
a week before that?
a week before that.
Okay. And was that wasn't
no,
here, right?
it was at Exeter Hospital.
Okay. And do you remember the dosing that you got?
I think it was 30
Units?
units.
Okay, and then was it true Botox, or was it one of the...
I believe it was Botox,
Okay.
but I don't know if I looked.
Okay, and then how many areas did you treat?
She treated up here, and I think there was a couple right here.
Okay, perfect. So perhaps maybe dosing wasn't strong enough to get you to that, like, yes, completion.
Yep.
And have you treated your crow's feet? These little guys on the sides?
Not recent. I feel like in past years they may have.
Okay. Let me see. Big smile. I think for purposes of today, let's go ahead and do it.
Okay.
And also, when you mentioned that you didn't feel that the results were that great with your previous Botox experience, sometimes when we treat all 3 areas in combination, then the muscles aren't competing against each other. So some are frozen and some aren't.
Okay.
And then others will compensate and work harder to start breaking things
Okay.
down.
Yep.
So perhaps if we treat this area as a whole, I think collectively you might have a lighter, brighter, fresher
Okay.
look that
Great.
you like. And then talk to me about this area down here.
So these have always, I feel like as I've aged, they've gotten deeper.
Okay.
And it's something that bothers me. It's the first thing I see when I look in the mirror.
Okay. Perfect. So I don't think they're terribly bad, and I think it's a combination of a little bit of volume loss, a little bit of muscle, as well as just natural skin breakdown. So we can certainly put in a little bit of, I'm going to choose a soft filler to slide in there, nothing full and thick, because I want you to be able to have good normal expression. But more importantly, the cannula will break up the skin underneath, creating that healthy tissue on top that we see. And then after we do the filler and the Botox, perhaps at the end of the summer season, you could consider things for skin resurfacing to really help take that to the next level, because we're aging on all the levels, and the filler is really working from behind. The Botox is working on the muscle to prevent the muscle breaking the skin down. But then we have those etched in creases. The cannula will help, but things like microneedling or just even a Frax laser will help to resurface the area. And that way we're working on the whole system, and you have like a better impact. The last time you were here, we did some cheeks.
Yep.
How do you feel about your cheeks now?
So I did notice a difference. I felt like, and I started to use, what is it? Contour. Because like I felt like they were, like you could see much bigger. Like I didn't use any today because I knew I was coming in. But I felt like it almost created a shadow here.
Yes.
And I love that.
Good.
Yep.
Okay. And when I look at your cheeks, I really like where you're at. I would like to see this apple just a touch fuller. And I do believe that will help this down here. So I think if you're up for it, I'd like to just add a touch more volume to this side. Everybody's asymmetrical, so we're working against that, but we want to work with that. So I think that would be good. Your jaw looks good back here. I like this, and I do believe that by what we're calling this out, if we put a little Volux in your chin and give that a little bit more projection, how do you feel about that?
Yeah.
And I think by helping to pull the tissue this way and lifting up this, we're going to naturally start to work on that area. So we'll use less filler there. So even though this is the primary symptom, we're going to start here, come here, and then address that.
Okay.
And I think that will be a good plan for you. This jaw looks good too, because you have this nice crisp jawline. Yeah, you naturally pull up a little bit. You're tense here with your mentalis, and most women are, and then as we age, the jaw begins to shift forward, so the mentalis is trying to pull it and keep it back. But then I think we tend to be more tense here anyway. So the filler will actually help to relax that, and then we can put a little bit of Botox there too to help further relax it.
Sure.
Good? All right.
Good.